I hate pausing this. This is good YouTube. Well, hello and a warm welcome. Dr. Sil here, junior doctor from Australia, training to become a psychiatrist, and I make mental health videos in my free time. Today is a reaction to another Ren song. It's Saturday morning, and my favorite thing to do on Saturday morning is a cup of lemon and ginger tea and binging on YouTube. And, you know, people hate on YouTube, but if you have good content, it's not a waste of time. And everything I've seen from Ren is what I consider very good content. Ren is a musician from the UK with a very complex medical and mental health history, who has used his, ability to make art and beautiful music to express and to be open and to be vulnerable and to connect and to help others. And I've used, this is not a lie, I've used some of the lines from his songs in my counseling of patients. One of my favorite lines of his, before we get into, sorry, I rant a lot, but anyway, I'm just going to keep going. One of my favorite line of his is, "In mental illness, there are no winners or losers, only students and victims." Oh, I love that. Because it's not about beating your mental illness. It's not about beating your depression or your anxiety or your emotional dysregulation. It's about understanding it and dancing with it. And he often talks about the dance. So he's put words to my feelings, which I love. It's great when he does that. Anyway, for today's video, it's all about Chalk Outlines, which is a song I have not heard before. I've gotten a lot of comments. If you can see here, I'm just scrolling through all these comments. These are all the comments that have Chalk Outline in the comment. So yeah, they just keep on going. Lots of comments to react to this song. I'm absolutely overwhelmed with the support this channel has gotten. I just love making YouTube videos. My goal is to hit 100k subscribers by the age of 30, which is in 2 months, and I'm at 83,000 subscribers. So anyway, it's just a bit of fun, and it's a great hobby, and I get to check out cool content. So thank you for all your support. If you do enjoy mental health education videos, please consider liking and subscribing. Let's get into the video. Very cool sound design with that building echo and then a cut. Eerie.
I'm still here in this bed that I crawled in. I hope that I'm someone else in the morning. So take this one, wash it down and you'll be fine. And walk around in the floating chalk outline. So it goes, let it be. In the gallows, balanced on my toes so I can breathe. But little by little, bit by bit, I push it back down with a new habit. If not for long, just for a while, I'll bury myself in these chalk outlines.
I think the hardest part of probably all of my Ren reaction videos is pausing the video. I mean, that hurt to pause that. I don't like it. I want to keep listening. But there's a lot has come to my mind to reflect on, and that's the point of these videos. And I guess if you want to listen to it uninterrupted, you can always go to that video. Let me just reflect on some of the words he's used so far. The opening kind of verse is about crawling into bed and hoping to wake up as someone else. That's a common kind of theme, to hope that when you wake up things have changed. And in major depressive episodes, one of the common symptoms is early wakening. So often people think that you'd have trouble falling asleep, and that does happen in atypical depression or in anxiety. But often in depression, people can fall asleep okay, but they just wake up at 2 a.m., at 3 a.m., and they usually just lie in bed, and it's dreadful. It's despair, it's horror of another day, and that physical feeling. And I try and remind people that mental illness, they're physical illnesses. You feel them physically. Anxiety is a tension. Depression is a weight. So waking up with this horrible weight can be really tough. Kind of people with a certain kind of depression, especially atypical depression or persistent depressive disorder like dysthymia, chronic, long-term low mood, and different personality vulnerabilities, can really get the sense that they're putting on a mask, that they can act, that they can look a certain way, that they can meet your expectations, and you might even think they're stoked and happy, but underneath there's how they really feel. And what comes to my mind when I talk about that is Robin Williams, such a comedian, such a so vivacious, and then to die by suicide, and to have this horrible background depression and substance use disorder with cocaine. So anyway, that's where my mind goes when I think about kind of depression or atypical depression and the masks that people have to wear. He also talks about being at the gallows and balancing on his toes. Like, what a vivid image. To just be on your toes at the gallows, obviously in a noose, and just getting enough air to survive. But just making it by that much kind of thing. It's really provocative imagery. Let's crack on. Oh my gosh, guys. By the way, I've just noticed that I have not subscribed to Ren. So sorry about that. It's funny how you can have channels you watch and love so much, but haven't subscribed to. If that's happening with you in this channel, please consider subscribing and help me hit my goal of 100,000 subscribers by the age of 30, which is in 2 months. I'd really appreciate it. But yeah, obviously I like all the videos of his that I watch, and I am now subscribed with the notification bell on. Let's keep going.
Sertraline and a sip of serotonin. Don't cry, 'cause there's a pill for everything. Take this one, wash it down and you'll be fine. The feeling goes and you draw a chalk outline.
So it goes, let it be. In the gallows, I'm balanced on my toes so I can breathe. But little by little, bit by bit, I push it back down with a new habit. If not for long, just for a while, I bury myself with a great big smile. Oh my, we trace ourselves in these chalk outlines. Oh my, erase ourselves.
I hate pausing this. And every single time I pause, my build up of emotion gets cut off because I intellectualize some response. I'm going to rewatch this straight after with no interruptions. I'm just going to cry. I'm going to be a mess. But I feel like I have to pause so I say something. Can't just play the whole video and just have me crying in the background. Got to reflect on some of the things they're saying. So that's an interesting verse. Sertraline and a sip of serotonin. Yes, sertraline is probably one of the world's biggest antidepressants. And it's a selective serotonin reuptake inhibitor. There are lots of different chemicals in the brain, lots of different neurotransmitters that the neurons use to talk to one another, and lots of different pathways. Some pathways are for motivation, some pathways are for focusing, some pathways are for moving, some pathways are for coordination of motor movements, lots of different neural pathways. And different neural pathways usually have different neurotransmitters that dominate the pathway. So there's kind of four main dopaminergic circuits. There are actually five, but no one cares about the fifth. There's serotonin's a bit more complicated. There's a serotonergic kind of nucleus called the Raphi nuclei down at the base of the brain, and then it kind of goes into lots of different parts of the brain. And then there's acetylcholine, there's histaminergic pathways, all sorts of stuff. But serotonin in itself, we're not entirely sure why antidepressants tend to work. And they're not the most effective medication out there. There's a lot of people that don't get a response, but they're definitely worth trying if someone has depressive symptoms. For the risk-benefit, usually, you have to assess the patient and work it out, but often the risk-benefit is in favor of giving them a trial. But there are side effects you've got to be aware of. But the thinking is actually when you're on SSRIs for long enough, you produce this other chemical called BDNF, brain-derived neurotrophic factor, which is important in neurons kind of forming synapses and neural plasticity. And so the thinking is, and this is all very theoretical and not proven yet, but the thinking is that SSRIs might help the brain form new pathways. And so if you're taking an SSRI whilst doing psychotherapy, you might be able to form, new habits, new pathways that are strong. But the whole point of this song is, that meds aren't fixing it. There's a pill for everything, so take this one. That is sarcasm, right? And yeah, that's right. Treating depression is a biopsychosocial approach. It is not just taking a pill. And I would never recommend to just take a medicine and forget about the rest. It's all about a holistic approach with physical health and exercise and diet being very important, and social health, connecting with friends, family, psychological health, getting habits and interests and doing the therapy to process previous traumas and neglect and things like that. So there's so much to do in someone's experience of depression, but it's always very complicated. It's always more complicated than it seems. That's something that I do believe. And here they had another really good line. I'll bury myself with a great big smile. That's that mask I was talking about before, right? I'm putting on the smile for everyone else, but it's not who I'm really feeling. And obviously that when you're putting on this mask and you're feeling more and more empty inside, that's relating to the whole theme of the song, this chalk outline. Yeah. Again, the best person to comment on this is Ren. I'm just describing my reflections as a doctor who works in psychiatry and the things I see. But it'd be interesting to hear what Ren's reflections on what chalk outline means for him. And I've never heard Chinchilla before, but she's got an incredible voice, and I'm loving the kind of dark, asylum-y atmosphere. I promise you, mental health hospitals are nothing like this. This is an artistic rendition. But I guess it's representing how he might feel about what psychiatric hospitals are like. Maybe he does feel that they're a bit archaic. But just to give you a quick update, and a little insight, there are cooking groups, there are, social work groups where they talk about the world and different countries and capitals. Like the mental health wards where I've worked are very dynamic. There's interesting groups, there's arts and crafts, there's lots of positive things to do, albeit these are in the wards where people have a higher level of function. If it's a high dependency unit, so a place where people are acutely very unwell, then it's really about just stabilizing the mental state. And yeah, they're not fun places to be, but they're absolutely necessary places to get people to a place where they can then move to the ward where there's more activities and things. It's all about safety. Got to keep people safe. All right, let's crack on.
It's such a perfect day. Take it just in case. Take it just in case. I'm scared of being okay, 'cause all things change. All things change. It's such a perfect day. It's a beautiful shade. It's a beautiful shade. I'm scared of being okay, 'cause all things change. But little by little, bit by bit, I'll push it back down with a new habit. If not for long, just for a while, I'll bury myself with a great big smile. Oh my, oh my, we trace ourselves in these chalk outlines. Oh my, oh my.
Erase ourselves in these chalk outlines.
Oh, this is good, YouTube. This is good. This is, that's not a multi-million-dollar budget music clip with, $10,000 costumes and Beyonce doing backflips. That's just raw, good, bloody art. It's interesting to hear Ren with an electric guitar. It goes very well with his voice. I loved how it's, I don't know if this is what they intended, but how they cut the music just before the word erase ourselves. Like they erased the music and then erase ourselves in these chalk outlines, and then they erased the lighting and cut. That kind of metaphor is always really nice. And the only last thing to kind of reflect on there is I bury it. I didn't think about this till now, but I push it down with a new habit. I guess there's some kind of, I don't know if it's cynicism or if it's not sarcasm. Maybe it's a bit of cynicism, like, I'll just get into a new hobby, a new habit to try and look like I'm not depressed. I think it's worth taking a bit of a tangent here just to talk about why people might get persistent depression or persistent depressive disorders. And I don't have the answer, right? But what's coming to my mind is, as a child, as a baby, when you're growing up, if you look at the stages of development, the first stage of development is trust. Can I trust the world? And the way that this manifests is that a baby will cry. Okay, and if a baby cries, does good things happen? If I make a noise if I add a stressor to the world because I'm uncomfortable, because I'm hungry, thirsty, or I need a poo, I mean, the baby doesn't even know. It's just crying. It's actually the parents that have to figure out what the baby wants. And that's called attunement. That's when the parents are trying to work out why is this baby crying? And the baby is learning that if it cries, then it can trust that a good thing will happen. A breast will appear so it can feed, or someone will change the nappy and I'm not covered in shit. And that's trust. That's fundamentally important. But if I cry and nothing good happens, no one appears, I stay cold. I wallow in because, if a parent has a substance use disorder or a mental illness or like a severe mental illness where they're acutely unwell and can't care for a child, obviously you can be an absolutely wonderful parent with mental illness if you're being treated, of course, and if you're doing therapy. But if someone is acutely unwell and they if someone is acutely psychotic and they don't even know their child kind of exists because they're more in their world of psychosis than in the care of the child, or if they're intoxicated, whatever, if there's neglect, then the child is learning that they cannot trust the world, that making noise doesn't help. And every other stage of development kind of works off of the previous one. Then the next stage around autonomy and understanding that you are your own person, because the psychodynamic psychiatric philosophy is that the baby and the mother, the baby doesn't really know that there's an outside world. It just knows that it has a drive. And then as the child realizes that the mother is someone different, or the caregivers are someone different, it learns a bit more that there's a child and there's an outside world, and that they can move, that they learn how to crawl, they learn how to be their own person. And that requires confidence for a child to do that. But if you've been neglected or even worse, abused, you can't develop that trust. And anyway, every next stage of development, which I've talked a lot about in my other videos, depends on the previous one. So yeah, if you've had a failure in those early stages, it's very hard later on to then be stoked about the world. And often you can get this pervasive dysthymia, this pervasive depressive disorder, which I've also got videos on. Anyway, guys, if you found that interesting, please consider, supporting the channel with a subscription and liking the video. That was really fun to do, and I just wish you all a beautiful day, full of love and connection. And that is it for this video. So I'll see you in the next one. All right, bye for now.